Hello, and welcome to another educational series in Providence's We Act to Go Carbon Negative educational series. We're excited today to speak with you about food as a potential solution to help us become carbon negative by 2030. Um, as a reminder, for any health issues that you may have, please see your provider. That is not the purpose of our educational series today, but we're happy to serve you as we can in Providence. Thank you. So, on our panel today, we have several guests. And first, I want to introduce them in round robin, and then I'll share a little bit of content with you, and we'll have a conversation with our guests. So, you'll see on the slide here first is Dr. Brian Cheesebro. And unfortunately, Brian was called away just recently today, so he's not going to be able to join us, but I'll be covering some of what he was going to say. Mark Dunn is the Executive Director of Food and Nutrition Services for Providence and is leading the charge across our entire health system related to food and also our carbon reduction. And Lisa Roberson, registered dietitian nutritionist, is the National Director of Wellness and Sustainability for Morrison Healthcare. And Morrison is the company that is providing the food services for many of our sites starting this past year. So next slide, please. Today's topic is really thought provoking, partly because we all are engaged with food. We eat food regularly. We think about it. We revolve around it with our families and holidays and culture, etc. And yet, the greenhouse gas emissions that come from food is significant, from farming to harvesting to transporting to cooking food, and also to waste of food. There is a significant environmental footprint associated with it. This is why this is the A in our We Act framework, agriculture and food, because we know that it is a significant contributor to the greenhouse gas emissions that the nation emits and also that we emit in Providence. So food is a big part of our lives. And in hospitals, we serve many, many patients and families and caregiver meals each year. I don't know the exact number. We might learn that today. But we do have 5 million separate patient encounters, and many of them eat or drink while they are with us in our hospitals and clinics. But we do end up wasting a lot of food as well, as mentioned. You can see here that these are some of the ways that we think about our carbon footprint. So these are different examples of greenhouse gases, fluorinated gases, nitrous oxide, methane, and carbon dioxide. And along the bottom, you can see that agriculture is about 10% overall. We know that waste is another piece of that. And the transportation of the food as well. So it ends up that agriculture and food is a significant input to our carbon emissions. Next slide, please. When thinking about food, the USDA, U.S. Department of Agriculture, estimates that nearly 1/3 of the food produced around the world is wasted. That's astonishing. When I first learned that, and I also learned that healthcare waste is somewhere between 15 and 18% made up of food waste, that was a call to action. 133 billion pounds, $161 billion. This is something that we can really do something about, not only in healthcare, in our hospitals and clinics where we serve food, but in our homes. So we'll learn more about that today. Next slide, please. The USDA and the EPA have established this hierarchy. It's an upside down pyramid. And you can see that toward the top of the pyramid is the most preferred behavior related to food recovery. So food recovery is what happens to food so that we can avoid wasting it. And at the bottom is the least preferred. And you can see that what we want to do first is source reduction. Don't bring in so much food that we're not going to either eat it, not going to serve it, overproduce. And to a certain extent, having oversized portions is another way that we can reduce food waste through source reduction, to have nutritionally appropriate portion sizes. What we could do next with excess food is to feed hungry people. So we do this in Providence through edible food recovery, donations to homeless shelters, to other entities in a community. We can also feed animals. This happens sometimes in agricultural areas with animals, with even gardens, etc. There may be some industrial uses for food. We know that, for instance, renewable natural gas can be made from excessive food, primarily composted. Composting is still preferred to incineration and landfill, but you can see that composting is pretty far down the chain here. And then the least preferable is incineration or landfill. So when we incinerate, we're using excessive amounts of energy to burn the food. That adds more greenhouse gases. And when we landfill, we're creating methane in the landfill as the food decomposes. That is a potent, very potent greenhouse gas. So these are reasons why we want to go to the top of the pyramid here through source reduction primarily. Next slide, please. So at Providence, it is a key priority, decreasing food waste, and Morrison will help us with that over the coming years. We aim to reduce the total amount of waste we're sending to landfill or incineration by 50% by 2030. So we want to send less than half of our total waste to landfill or incineration by 2030. In our food and nutrition services, that happens because of wasting less food on the prep side, and we'll hear about that today. Wasting less food after people are finished with it. That means composting primarily. Using less in the way of disposable products to the extent we can. Composting whatever we can. So we have a lot of different ideas in place to help us reach that waste goal related to food. At the same time, we are also always helping to relieve hunger. As you know, Providence is committed to supporting our communities. We're often supporting our food banks sometimes with food donations, sometimes with dollars. So by working on these areas together, we can be treating our communities' needs, especially in terms of health equity, and also our planet's needs by decreasing the greenhouse gases that come from wasting food or selecting high carbon intensity foods. So this is something that we're going to talk about today. So I think that's all the slides we'll have right now, and we'll just talk a little bit more about some of the background related to food and carbon emissions. So we know that, as mentioned before, agriculture generates almost 10% of U.S. greenhouse gases. This is from 2018 data. And these come from livestock, such as cows, soils, produce production. It also comes from fertilizers, from nitrous oxide and methane. It also comes from transportation of that food, as we discussed, also from preparation and storage of the food, and then again from wasting of the food. We have an opportunity with rethinking about food from the carbon perspective. You all have probably heard a lot about having a plant-forward diet. And again, it comes out through the science and measurement that a plant-based diet, and it's not absolutely no meat or no dairy, but having more percentage of plant-based creates fewer greenhouse gas emissions. So it also turns out that is seen by many nutritionists, and we'll get Lisa's perspective, as a healthier diet. There's a lot of controversy always about which diet is best, and people have their preferences, and we know this, and we're not here to tell people how to eat. But we do suggest that it's good to learn about not only the nutritional aspects of food, but also the planetary aspects of food. And this can be done with your own research so that you can make informed decisions. This is a little bit like how we handle our procurement. So in Providence, those of you who are in Providence, you know that we have a environmentally preferred purchasing policy. And what that means is we are asking people, when they make decisions about what to purchase, that they think about all the things that are important, like quality, reliability, safety, regulatory, price, but also about the environmental impacts. So we would say the same thing about food, our food choices. We want it to taste good, to be nutritious, to be affordable. And we also want it to be good for the planet, because we're working to live in a way that really preserves the health of the planet, because we know that our own health is dependent on that. So that's just a little bit of background about a linkage between food and health, which is well known, food and carbon, which is something we're going to talk about more today, and then carbon and health. Let me just make that point a little more clear about carbon and health. The greenhouse gases that come from what we've been talking about here, plus all the other sources of greenhouse gases, energy, different chemicals, transportation, those are what are driving up the global temperatures. And the global temperature increase, called global warming, global heating, climate change, causes a lot of health problems, from respiratory disease to heat stroke to more illnesses from vector-borne diseases, to asthma, to trauma in storms or fires. So because we're committed to health and our vision is health for a better world, we're committed to planetary health and to really trying to change the curve of that global heating. So that connects those dots, I think, a little bit better. So let me turn to our wonderful guests, because I've been talking a lot, and start to ask a few questions. So Mark, let me ask you some questions first. So Mark Dunn, again, is the Executive Director of Food Nutrition Services, and you have enormous responsibility to source food in ways that are, what I just said. They're healthy, they're affordable, and they're good for the planet, across our whole organization. It's kind of overwhelming to think about all the meals we serve in 52 hospitals. I think probably they all have cafeterias. I have to ask you that. Probably some other places have cafeterias, the university, the high school, some of our medical office buildings. And we serve meals to patients, families, and employees across all of these sites. So tell us about this. Tell us about what you're working on, and how are you transforming the way food is delivered across Providence?
Yeah, thanks, Beth. I appreciate that introduction and the eloquent words. You said a lot of what I would probably include in this message, and I appreciate that. We do have, as Beth mentioned, we do have over 50 hospitals and well over 70 distinct retail outlets that serve our guests and our caregivers, as well as the millions of patient encounters that Beth mentioned. In fact, we serve well over, I think the last count we had was well over 5 million meals a month across our organization. So we have a lot of opportunity to focus on responsible food sourcing across the organization. And stewardship of our resources has always been very important to our organization. In fact, it's part of our mission. And so that sustainable, responsible purchasing fits in well with what we need to do. Over the years, our FANS leaders, our food nutrition services leaders, have introduced many different initiatives to help reduce our carbon footprint. And these, for the most part, have been done on a local and regional level. Things like center of the plate protein reduction, meatless Mondays, sugar sweetened beverage elimination or reduction from some of our ministries, and the introduction of infused water programs, and the reduction of bottled water in some cases. And all of these are great, and they have all of the intent is to reduce the carbon footprint, as well, and in many cases to improve the health of our caregivers and our patients and our guests. But recently, we've undertaken a couple of initiatives that are, I would say, system-wide or close to system-wide, that should have a significant impact on our carbon footprint. And I'm happy to talk about each of those a little bit today. The first one I would say revolves around waste management and source reduction, the top of that inverted pyramid that Beth showed earlier. We've partnered with Lean Path, which is a waste reduction organization or system out of Portland, Oregon, that will help highlight at our ministries the food waste that's being produced, with the end goal of really keeping a close eye on that waste and reducing that waste. It's a lot harder to waste the food, we find, in our at our frontline level, when you see it and you record it and it's accurate, the amount is accurately captured. So that program, the Lean Path program, is rolling out at about 80% of our ministries across the system this year and into next year. So we're excited about that. In conjunction with Lean Path is probably our most aggressive initiative to date, which is our partnership with Morrison Healthcare. to manage our food and nutrition services in about, again, about 80% of our ministries across the system. Um, Morrison Healthcare, and you'll hear from Lisa here in just a couple of minutes. They're an industry leader really in food sourcing through their food buy program and in sustainable purchasing. And they're going to help us integrate our carbon neutral uh, initiative into their purchasing program. We've taken the language and incorporated an integrated low chemical and low carbon intensity food language into our agreements, and specifically into our contract with Morrison Healthcare. And we've continued to insist, and quite frankly, Morrison Healthcare has been a great partner in this, in maintaining local purchasing whenever possible. So that's something that we continue to strive towards. We'll continue to partner with Morrison to achieve the results that we desire. So, Beth, I think I'll turn it back over to you, unless there's any questions, follow-up questions.
I have just one follow-up question real
Yeah.
quick. Do you have any idea yet? I think the Lean Path thing is really cool, and I've seen it in action a little bit. And I just wonder, do you have any idea yet how many tons of food that might save in a year at 80% of our sites?
I don't have a sense for the volume,
Yeah.
but I do know that conservative estimates can be anywhere from 4 to 10% of our food cost
Wow.
savings related to just saving that waste. So
Isn't that crazy?
it's significant across our
Yeah.
system.
Right. Excellent. Well, thank you. That's really interesting.
Of course.
So, Lisa, let me ask you some questions. Let's talk about scaling our programs to meet these large goals. You know, our carbon negative goal is the boldest U.S. Climate goal in the nation, and it is enormous. And we're working hard on it, and really happy to partner with Morrison and with our whole food nutrition services program. So, tell us about Morrison's approach to environmental stewardship. What are your priorities, and how do you track the carbon emissions of food, for example?
Yeah, thanks, Beth, and very privileged to be here. I really appreciate the partnership that we've had with Providence. Mark, you said it. It's a big contract, and honestly, when we look at the language of where the vision that Providence has, what the vision is that Providence has for the future, it is truly game changing. We're not seeing any system, very many systems at this large of scale looking to make these significant changes in order to become carbon negative. So we are here, we're excited. And part of that alignment in being able to support environmental stewardship at this level is because we as a company also have priorities on our own sustainability roadmap. And we really focus around four core initiatives. The first one is reducing our carbon impact. So it's no happy accident that we have somehow found each other and we're here together working on this initiative together. We actually just had a big announcement ourselves. COP26, the Conference of the Parties, that centers around climate change. It just convened in the UK, and our goal, all of the countries involved, the goal is to secure global net zero by mid-century, so 2050, with every country that's involved limiting their greenhouse gas emissions so that we can all keep global warming below 1.5 degrees Celsius. So our parent company, Compass Group, has announced our commitments to participate in becoming climate net zero by 2050 as well. So I think walking the walk is really important in order for us to be in this partnership together. We are just as passionate about reducing our carbon impact. And second of all, prioritizing ingredients from local and diverse sources, making greener purchasing when possible. As Mark said, setting the stage and the expectation for us to follow suit as a food service company is incredibly important. It's a passion that we have on our own. And then, of course, reducing food waste and also striving to create a circular economy. So, it's difficult. We take a food from the environment, we make it into stuff, and then we throw our waste away, right? And we have to really look at how we as a food service operation can partner with Providence to transform or create a circular economy that focuses on reducing, reusing, and recycling. So we track all of our local, sustainable, and diverse purchasing annually as an organization. And just to give you an idea of where we focus when we talk about looking for opportunities to use our purchasing power to create a greener supply chain, 90% of the seafood purchases that we make are sustainable. 10% are really difficult. There's not very good traceability in seafood. And so there's always a gray area around that. 98% of the milk and yogurt that we serve is growth hormone free. 93% of our shell eggs are cage free, and we're now beginning to purchase liquid cage free eggs. Now, not without supply chain challenges. So we're navigating that as well. But we're also taking the opportunity, we have tools to help track the carbon emissions of food. And that's something we're working with Dr. Cheesebro and Beth and Mark on. We have a program that helps us to assign carbon output measurements to areas of food service operations, including kitchen equipment, utilities, foods that we purchase, and then also the carbon output of the menu when we put all of those foods together. So we make sure we set metrics and KPIs and report out CO2e emissions so we can help monitor our progress, and we'll work together mutually to create these goals. And so focusing on environmental stewardship is a pretty important piece to our business and to hopefully our mutual success.
Wonderful. That's so great to hear about, and to hear about your experience and your tools. And, as you pulled in, Mark, the lean path as an existing and proven idea. And I know, Lisa, we've spoken about the carbon footprint, which we hope to be able to adopt at several, if not most of our sites at some point. So we're looking forward to that, because we need tangible on the ground change to really make progress to our goal.
Absolutely.
Let's see. We do have a couple of questions. So let me see here. Mark, I'm going to ask you. Providence procurement efforts to secure lower carbon, lower chemical foods is relatively new. I mean, you may disagree with that, because we have certainly been working on, the hormones in milk for a long time. Some sites are working on antibiotics in meat. But just looking back on this, because you've been in your position for a while, tell us about some of the key lessons learned. What has worked and what hasn't, and how might this evolve as the program broadens?
That's a great question, Beth. I think that probably the biggest lesson learned is that we can we work together as a system. We are in 50 plus different communities across the West, and each of our ministries has done some great work locally, but without kind of that system approach to our purchasing and sustainable purchasing, achieve the results, and we certainly wouldn't be able to achieve our carbon neutral goal without this systemic approach to purchasing. So that's where these large scale initiatives have really come into play.
And that's been an evolution over time, hasn't it? As the
Sure.
As the system has gotten more systematized, as we've added more sites. I know
Yeah,
as a go ahead.
and I was going to say it's a balance too, because within Providence, it's super important that our ministries have autonomy and are able to operate within the community that they serve. So that's why local purchasing is so important. So it's going to be a balance, and I'm certain that the partners that we've aligned ourselves with understand that, and that they are going to work with us to achieve our goals.
It's great, and it's cool to see, just see these different little tests of change across the health system, because LA is different than Polson, Montana, or Anchorage is different than Hobbs, New Mexico. So pretty interesting opportunity.
Definitely.
Lisa, let me ask you. We have a question who came in through the audience, and I'm just going to expand on that a little bit about As I mentioned at the beginning, food is important to everybody. We eat multiple times a day. People are oriented around food a lot of the time. How can we individually and as caregivers, so us at work and us at home in our daily lives, impact a better health for the planet by food choices? So, for instance, how do we select lower carbon intensity foods?
Yes, that's a good question. That's a great question. It's a twofold approach. First thing is absolutely food waste reduction must go hand in hand with that lower carbon selection. And when we look at lower carbon selection, my recommendation is to find a way to eat a plant-based protein, not necessarily just plants, but plant protein in place of animal-based protein at least once a week, and you'll see more recommendations around that. You see every fast food chain serving like plant-based burgers, which are still a processed food, but really switching over to tempeh, edamame, tofu, beans. All of these types of plant proteins pack a powerful punch of protein and fiber. They fill you up, they keep you energetic. You see a lot of sports people switching over pre-game because they can have the energy to finish games. This is interesting. So it's not only is it better for the environment, it's better for your health. When you look at carbon intensive foods on the scale, if you look at how many carbon emissions are required for land use or for emission of CO2, for 1 million calories, our land animals are absolutely the most carbon intense. So just even one meal a week, eating that plant protein instead of an animal-based protein, decreases that impact significantly. And not only from a planetary aspect, but from a health aspect, that also decreases saturated fat intake by 15% in that 1 week. So
Wow.
that's the easiest way to definitely tackle that.
That's cool. Yeah, I love that when we have a win-win, a co-benefit, as they say. It's kind of like riding your bike to work. It makes you healthier and reduces air pollution. So a plant-forward diet makes you healthier and decreases greenhouse gases. We have just another minute or so, couple minutes. Let me ask both of you this question. What trends, if any, are you seeing with the impact of the pandemic on food related supply chain and food waste? That might be a very large question.
Yeah, that's a great question. And I was thinking about, well, we're always thinking about the pandemic at this point, right? Um, how it's affected our food supply and our offerings. I mean, our patient program has remained pretty stable throughout the pandemic, although we have seen some availability come in, or lack of availability come into a play. Biggest things that we've seen are related to retail, with the reduction in guests, the the lack of the ability to serve self-service items like salad bars and any type of buffet. Um, I in my view, it's actually improved or reduced the waste that we see in our retail outlets. Um, Most of the food now is prepared to order or to go, and so we don't have the large bit of waste that we would have had to serving salad bars and self-serve bars. So that's been a good thing. It certainly has been a reduction in the variety that we can offer to our customers. So that certainly isn't a plus. But I don't know, Lisa, what do you think?
No, I agree completely, Mark. And I think simplification is coming into play now. We're not getting all of the foods that we're used to having. We don't have the luxury of having every variety. So we really have to simplify as consumers on our expectations, I think. And there's a lot of waste that's being produced with individual packaging because of the pandemic. So safety is a priority, but making sure we can find ways to save in other ways, reusable water bottles, to offset all of the package waste that we're producing, trying to keep everyone safe. So I think we're heading towards a perfect storm of really being hyper focused on how we minimize impact on the environment and how we simplify our own tastes and do with a little bit less, so that we can all work together to help get through this and also make a positive impact on the environment.
Well said. Yeah, I think if I'm summarizing just briefly what I've heard today is a certain sense of optimism about our progress together in Providence with Morrison, which is great. That one of the big things we can do is reduce waste. All of us can do that by going to the top of that pyramid, as you mentioned. And the idea of the co-benefits of as you were talking about it, Lisa, with the health benefits of eating in a way that's actually better for the planet as well. And Mark, I think that was an important comment about the um, some of the I won't say positive, but some of the things that we've learned from the pandemic that may be worth taking forward in terms of creating amounts of food that are going to be nutritionally important, appropriate. That may be finding different packaging as already has happened because there's had to be so much more of it in use. So, we're all in this together in both the pandemic and in our climate crisis, and it's exciting to see progress. And I think also the world is kind of waking up to this in different ways, more tangible with more tangible solutions, and that's really heartening to me. So I'm thrilled to be able to work with both of you and with all of our food and nutrition teams, and looking forward to what will emerge over the next year or decade. And I really appreciate both of your time today. And thank you for joining us. And also thank you to all of you for listening. We can drop some information into the chat. I think you've seen a little bit of that. We'll have another episode coming up soon. And thank you for spending the time with us today as you learn about our efforts to become carbon negative. And we have this important discussion about food. Thank you.